Addison's disease, which is also called adrenal insufficiency, is an uncommon disorder that occurs when your body does not produce enough of certain hormones. In Addison's disease, your adrenal glands, which are located just above your kidneys, produce too little cortisol and often too little aldosterone. Addison's disease can occur in all age groups and both sexes. It can be life-threatening. The treatment typically involves taking hormones to replace what is missing. Symptoms of Addison's disease usually develop slowly, often over several months. Often the disease progresses so slowly that the symptoms are ignored until a stressor, such as an illness or an injury, occur and make the symptoms worse. These signs and symptoms may include extreme fatigue, weight loss, decreased appetite, hyperpigmentation, which is the darkening of your skin, low blood pressure that can even lead to a syncopal episode, which means fainting, a craving for salt, low blood sugar, nausea, diarrhea, or vomiting, as well as abdominal pain. It can also be accompanied by muscle pain and joint pain, irritability, changes in behavior such as depression, and loss of body hair and even sexual dysfunction in women. Sometimes the signs and symptoms of Addison's disease can appear suddenly. This is called an acute adrenal failure, or an Addison's crisis. This can lead to a life-threatening shock. You should seek emergency medical treatment if you experience any of the following signs and symptoms, including severe weakness, confusion, pain in the low back or your legs, severe abdominal pain, vomiting, and diarrhea, which will lead to dehydration, or reduced consciousness and confusion. In an Addison's crisis, you will also have low blood pressure, hyperkalemia, and hyponatremia. You need to make sure that you make an appointment with your doctor if you see these common signs and symptoms of Addison's, such as the hyperpigmentation, severe fatigue, unintentional weight loss, nausea, vomiting, abdominal pain, lightheadedness, fainting, salt craving, muscle or joint pain. Thank you.
Hi, I'm Heather, and I'm here to talk to you about how we diagnose Addison's disease. The diagnosis of adrenal insufficiency associated with Addison's disease is a four-part process. First, the blood cortisol is measured. Other tests are usually needed to confirm diagnosis. Measuring corticotropin will determine the level of defect, and once it's known, further evaluation is done to determine the cause of the defect. To determine your cortisol level, we draw a blood sample early in the morning when levels are typically high. If the level is very low, you are likely to have adrenal insufficiency. If the level is above normal, you are unlikely to have adrenal insufficiency. If your levels fall somewhere in the middle, more testing will be necessary. An ACTH stimulation test is done to establish a diagnosis. A blood sample is taken to measure baseline cortisol level. A high dose of ACTH is given into a vein, and then another blood sample is taken 30 to 60 minutes later to measure your cortisol level again. A low dose of cortisol at this time confirms adrenal insufficiency. To rule out other underlying causes, most clinicians will order a CT scan to evaluate the adrenal glands. A chest x-ray may also be ordered to rule out tuberculosis. Your clinician may also order an MRI of the pituitary gland and hypothalamus to determine if a mass or abnormal growth is present and to rule out fungal infections and adrenal calcification. A complete metabolic panel will also be ordered to examine if hyperkalemia, hypochloremia, hypoglycemia, anemia, and increased blood urea nitrogen are present.
All right, so there are some medications that people with Addison's disease can take. Oral pills or tablets may be used, such as prednisone, methylprednisolone, or hydrocortisone. These medications are corticosteroids and help with reducing inflammation. Prednisone and methylprednisolone can be given as a once daily medication or split into twice a day dosages. Some people have difficulty sleeping with this medication, and so once a day dosing in the morning is preferred. Hydrocortisone is closer to your body's own natural cortisol and is more conducive to your body's normal wake-sleep cycle, so twice a day of dosing is recommended. Another medication, fludrocortisone, may be used to replace aldosterone, which will increase sodium and water absorption and help increase your blood pressure. These medications will be taken for life to replace these hormones that you cannot produce. In addition, you will need to get plenty of sodium in your diet, especially during heavy exercise, when it's hot outside, or if you have stomach issues such as diarrhea or vomiting episodes. If you're ill with vomiting and can't keep down your oral medications, the doctor may need to prescribe injections for you as well. Always keep medication handy. Missing even one day of medication can be dangerous, so keep a small supply of medication at work with you or with you whenever you travel. And you should also carry a glucocorticoid injection kit, which contains a needle, syringe, and injectable of corticosteroid to use in case of emergency. These emergencies may be if you're feeling faint, you have a serious injury, such as breaking a bone or vomiting, and you can't take the oral medication.
When dealing with Addison's disease, there are some lifestyle changes a patient has to take into account. Education is important when managing this disease. A major lifestyle change is diet. Dietary changes include a significant increase in sodium, since the patient with Addison's disease are at risk for hyponatremia due to adrenal insufficiency. Aldosterone is severely decreased, and sodium is not able to reabsorb efficiently. Adherence to medications is just as important. For example, a patient will be taking fludrocortisone, which acts on the kidneys for sodium reabsorption and potassium excretion. It is also important to not stop these medications abruptly because it can cause vomiting, confusion, fever, and possibly weight loss. If these side effects occur, it is important that you call your primary care physician immediately. Next, wearing a medical bracelet or necklace is advised also in case of emergency situations, so emergency personnel can medicate without complications to contraindications. It is also important to avoid strenuous exercise. Sweating can also cause further sodium loss. It is also advisable to reach out to support groups if you have adrenal insufficiency. Immunosuppression is likely due to some steroids, and there is a possible altered body image that one may not accept right away. Lastly, management for this disease is lifelong, and it is important to adhere to these interventions.